blood is the most important fluid of our body. The subject of bleeding or drinking blood has scared a lot of people throughout our history. It has been used both in horror movies and books. But what is blood?
Many researchers consider it as an organ, but as a liquid one. This fluid circles our system to deliver necessary substances such as nutrients and oxygen to cells. It also has the function of cleaning the body by transporting the waste products away from our cells. The latest news is that now it is shown blood can function as medicine for your injuries with the minimum side effects. Contrary to this, if blood seeps into tissues because of an injury, it can give inflammation and cause a prolonged healing process. But there are some stuff in the blood that can accelerate the cure. Today's video is about that. Welcome to our channel, Doctor on Tube. Platelet-rich plasma therapy is a form of regenerative treatment that can harness some components of the blood, called platelets, and amplify the natural growth factors your body uses to heal tissue. PRP treatment has received significant attention from the media and has been used by numerous professional athletes. Your blood is made of two major components, plasma and blood cells. Plasma is the liquid portion of blood largely composed of water and proteins, and it provides a medium for red and white blood cells and platelets to circulate through the body. Platelets, also called thrombocytes, they are blood cells that cause blood clots and other necessary healing functions. It also contains growth factors that can trigger cell reproduction and stimulate tissue regeneration or healing in the treated area. Platelet-rich plasma or PRP is simply a part of blood that contains more platelets than normal. Since PRP is a substance derived from one's own blood, it is not considered a drug. FDA clearance means that doctors can prescribe and administer PRP if they believe it's in the best interest of the patient. However, lack of the FDA approval means that PRP treatments may not be covered by insurance. PRP injections are prepared by taking anywhere from 1 to a few tubes of your own blood and place it into a device called a centrifuge that rapidly spins the sample. After few minutes of spinning, you will see a red-colored tube now has almost 3 different layers because blood is now separated to 3 different portions. On the top looks clear and yellowish is the liquid plasma, the portion at the bottom that is red blood cells because the heavier red cells sink to the bottom of the tube. And in between these 2 layers is a layer of platelets and other lighter cells. Plasma now is separated to its components. Platelet-rich plasma can now be collected and treated before it is delivered to an injured area. The mechanism behind PRP healing process is not completely understood. Studies show that the increased concentration of growth factors in platelet-rich plasma may stimulate or speed up the healing process, shortening healing time for injuries, decreasing pain and even encouraging growth. In some cases, the clinician may use ultrasound to guide the injection. All this means increased concentration of specific bioproteins or hormones, called growth factors, in a specific area to accelerate the healing process. Several basic science studies in animal models suggest that PRP treatment can improve healing in soft tissue and bone. For example, increased numbers of cells and improved tendon strength have been noted in Achilles tendon injuries, and improved muscle regeneration has been shown in gastrocnemius or calf muscle injuries. These favorable findings in animal models have led to the widespread use of PRP treatment for a variety of conditions, including acute and chronic tendon problems, as well as injuries to ligaments and muscles. Some early-stage clinical studies in humans have been promising, but are limited by their study design and few patients. Nonetheless, a recent study in the Journal of the American Medical Association reported that there was no advantage to using PRP injection compared to placebo injection for the treatment of inflammation of Achilles tendon. In a small study involving knee osteoarthritis, PRP treatment was shown to be more effective than hyaluronic acid treatment. Early studies indicate it may help relieve pain and stiffness by modulating the joint environment and reducing inflammation and arthrosis in many joints. PRP has also resulted in positive or similar results when used in the treatment of rotator cuff tears and medial collateral ligament, so-called MCL injuries in the knee. Clinicians first used PRP to accelerate recovery after jaw or plastic surgeries. Now, post-surgical injections have expanded to help heal muscles, tendons and ligaments, as procedures on these tissues have notoriously long recovery times. These shots may be able to treat a range of musculoskeletal injuries and conditions. For example, chronic tendon inflammation, such as tennis elbow or jumper's knee, can often take a long time to heal, so adding this shot to a treatment regimen can help to stimulate the healing process, decrease pain, and enable a return to activities sooner. This kind of treatment can be effective in treating male pattern baldness, both in preventing hair loss and promoting new hair growth. Additionally, it can aid the stimulation of hair growth after hair transplants. Furthermore, they used sometimes as an anti-aging treatment, but there is little evidence to show that PRP reduces wrinkles and other signs of aging. The side effects of PRP injections are very limited because, since it is created from your own blood, your body will not reject or react negatively to them. That's why these injections are safe and can be administered alone or used in conjunction with other procedures. This treatment is given in the hopes of optimizing the initial inflammatory response of healing, so anti-inflammatory medications should likely be stopped at the time of this therapy. The results are most noticeable after several weeks for joint and 6 months for scalp injections and are not permanent. Patients may require additional injections at the direction of their doctor. It also does contain endogenous growth factors, so some agencies consider it to be a performance-enhancing substance. For instance, the World and the United States Anti-Doping Agency forbid the injection of PRP within muscles because of the possibility that the growth factors could enhance a person's performance. However, there are currently no data to suggest that PRP is actually a performance-enhancing substance. Major professional sports leagues have not yet addressed the topic of PRP. The whole procedure is considered a low-risk process and does not usually cause major side effects. This method involves a blood draw, so you should make sure you are hydrated and have eaten beforehand to prevent feeling lightheaded. After that, you may experience some soreness and bruising at the injection site. Risk of an allergic reaction, if not zero, is much lower than with other injectable medications like corticosteroids. Less common risks of PRP injections include bleeding, tissue damage, infection and nerve injuries.
We're gonna cover many diseases, so if you want to be updated about newest treatments and the research, consider subscribing and especially click on the bell icon, otherwise we won't be able to notify you about our upcoming video.
Year old male.